Welcome to the discussion. My guests today are Steve Posnack, the Deputy National Coordinator for Health IT in the Office of the National Coordinator for Health IT in the Department of Health and Human Services, Dr. Ken Mandel, the Director of the Computational Health Informatics Program at Boston Children's Hospital, and Dan Gottlieb, the Technical Architect in the Computational Health Informatics Program, also at Boston Children's Hospital. Everyone, thanks so much for taking the time. Let me set just a little bit of context for our discussion. In August, the Office of the National Coordinator for Health IT awarded 2 grants totaling about $2 million under something called the Leading Edge Acceleration Projects in Health IT, or LEAP for Health IT. It's a grant program. LEAP and Health IT awardees are seeking to create methods and tools to improve care delivery, advance research capabilities, address emerging challenges that inhibit the advancement of interoperable health IT. Whew, it's a lot, Steve. One of those awardees was Boston Children's Hospital, whose project, the Cumulus Q, is an open source platform for improving the fast healthcare interoperability resources, or FHIR data quality access ecosystem. The idea here is to improve data management and use data to drive better and more accurate healthcare and health equity decisions across the board. So that's where we're going to start. Steve, lead us off. LEAP Health in Health IT is an amazing funding opportunity. Tell us a little bit more about it.
Yeah, great. Thanks for the opportunity to be with you today, Jason. And you ready to use some of the acronyms that we pride ourselves in? So I'll try to keep that steady. But the LEAP program overall is a little bit over 5 years old. As you mentioned, we've had another round of awards this year in 2023, and really, the healthcare field, especially in digital health, moves quickly and has a lot of innovation that takes place. And so as the latest technological advancements and breakthroughs get made, we start to run into certain chicken and egg situations where there may not necessarily be enough maturity in a certain area for wide scale industry adoption. And so we look at using LEAP as seed funding and early testing and prototyping and piloting for different types of use cases within the digital health ecosystem. And so the LEAP program overall has, over the past several years, provided funding that's created scaled opportunities for the industry to implement. And Boston Children's Hospital has been a multiple award winner over the past several years. This one, as you mentioned, is focusing on data quality, which is one of the 2 areas that we put out in this award cycle. The other was, again, as you mentioned, exploring the advanced use of the FHIR standard, or fast healthcare interoperability resources, and those capabilities. And there's another award made to colleagues in New York through the Western New York Clinical Information Exchange, otherwise referred to as HealthyLink. But we're here to talk about the BCH award today, and I will turn it back over to you.
Thanks. And I think one of the keys here is we've seen such a huge change in the health IT world. And over the past few years, one of the big changes has been the focus on data. And it's always been about the data. But early on, and I remember the days when George W. Bush, the president, talked about health IT by whatever the date was, 2009 or something like that. And we all kind of smiled, knowing that that's electronic health records, great. But really, what we've seen is really about the data. Is that the biggest change you've seen over the last 4 or 5 years, and that's why the LEAP in Health IT has been such an important program?
Yeah, absolutely. And so the dates, just to give you the timeline there. President Bush originally set a date for electronic health record adoption by 2014. Sprinkled in that, you had the HITECH Act of 2009, and so that was right at the beginning of President Obama's term, large investment in electronic health record technology. For the listeners that may be familiar with the quote-unquote meaningful use programs, those are the EHR adoption incentive programs that the Centers for Medicare and Medicaid led for all of the last decade and continue through this time now. And so we find ourselves in a great position where that investment has really paid off. We have almost all hospitals across the United States have electronic health records. Greater than 80% of ambulatory providers also have electronic health records. And so you have this vast array of digital data now that are available in systems. And now, as part of the LEAP initiative as well, is trying to make the most out of the digital data in those systems, and also identifying where there may be quality or completeness issues.
Steve, I appreciate that background. I forgot it was 2014. I always think it was much sooner than we realized, but you're right. I jumped my dates there a little bit. But let's talk about the most recent awards, and that's when I bring in Dr. Mandel from Boston Children's Hospital. Ken, talk a little bit about what you all are doing, the Cumulus Q program, and how Leap Health IT is helping you all really push towards, if you will, better data, better health equity data.
Thanks, Jason. Let me talk about how we have used some LEAP awards to go from one stepping stone to the next and get us quickly up to the current moment. So our first LEAP award took advantage of an application programming interface that ONC had asked us to design called the Smart HL7 Bulk Fire Access API. And what is that? That gives a hospital system or an office practice population level access to the electronic health record data exported in a push button fashion across an API. Though that capability is not built in to electronic medical records under normal circumstances. And the vision was to have this be a public API, the same version of the API, the same technology and data coming out in the same format, which is FHIR, no matter what brand of EHR is being used and no matter where it's being used. We did some initial work to show how that technology could be used to monitor value in care, looking at data coming from the payment system. CMS actually has implemented bulk FHIR on the payer side, as well as from the delivery system, the electronic health record data. And the work from that LEAP award was one of the pieces of evidence that bulk FHIR was being used in the real world that helped Steve Posnack and team include bulk FHIR in the 2020 ONC 21st Cures Act rule, 21st Century Cures Act rule. The next LEAP award recognized that that rule had just been finalized, but that it would be a couple of years before bulk FHIR was required in all EHRs. And that happened at the end of 2022. And that award proposed and then we acted on creating something called Cumulus, which is a listener so that you can listen at the bulk FHIR API and produce population health data sets that include data coming across the API from both clinical notes and structured data, and that we could share those data for multiple population use cases, including, for example, CDC biosurveillance. Can we instrument the healthcare system to be a biosurveillance data source? That was LEAP 2. Our third LEAP award, which is the one today, is about knowing that it's a new technology. The data are being exposed in a standardized format, same format everywhere, FHIR, same set of data elements everywhere, the US core for data interoperability. But we know that in any health IT project, in any data project, the data are not clean and effective and complete and properly formed until there's a process to monitor it. And that's what the LEAP award that just begun is about. How do we get a set of tools that we can deploy across the health system to monitor the quality of this incredibly important data source, bulk FHIR, as well as the Smart on FHIR interface and other successor interfaces that come along as well.
First of all, obviously, congratulations to you and your team at Boston Children's Hospital for 3 LEAP awards. And it seems like the progress that's being made is incredible to really create the interoperability, to make sure data can be shared. All of this piece of this is really aimed at not just driving better decisions, but also ensuring health equity. And that's where I kind of want to take the conversation. And I can open up to anyone on the panel here. Why is this LEAP and health IT, or the projects that come from it, so important to help to really drive some goals around health equity?
Yeah, sure. I can jump in. This is Steve. So as part of ONC's overall work in interoperability, and you have to remember, part of the Department of Health and Human Services. And so as we look at the convergence opportunities now that involve, individuals seeking care, it's not just care that they're getting in an acute care setting, going to the doc, going to the hospital. they're also getting care in their community and engaging in services that are out there as well. And so as we look at the data that's available both on the clinical side, but also in the community side, on the human services side, there's a lot of opportunity to create new ways to improve care models. And earlier this year, ONC released a social determinants of health information exchange toolkit, which has some practical on-the-ground resources for stakeholders in the health IT community, and gives some implementation guidance among other factors to keep in mind. And so this is part of a larger umbrella of set of approaches in which the LEAP project fits from an HHS perspective.
I can add one aspect to that I think is important, and that is that today, to get data out of electronic health records and to map it into a usable format where it can be shared and combined with data, let's say from other sites of care, that could be for quality metrics, for example, or it could be for biosurveillance, or it could be for research, requires teams of individuals. And I can tell you, having been involved in many of these projects, that the mapping portion of that, when you have to map it into a common format, is not a widely available skill set. And what that means is that in federally funded and other networks and projects where data are needed, only the most advanced medical centers can participate. So from an equity perspective, and think about this from the perspective of artificial intelligence and the algorithms that need to be designed and need to be fair, we need data from the whole health system out to the edges. And by having a regulated interface that enables a federally qualified health center to participate just as easily as a Mayo Clinic, will improve the diversity of the data that trains the algorithms, and they will be more fair. So AI is, I think, is the example of the day, but is really just one of many. It's really just an example in a class of examples.
Yeah, and I mean, building on that and kind of what Steve mentioned as well, I think one of the really exciting things about having certified interfaces in EHRs that the ONC is kind of regulating means that any improvements we make to the data quality at any institution flows into improvements at multiple institutions. So since these interfaces aren't being developed as one-offs and are part of kind of the core software, as we figure out kind of where there are elements we want to improve in the data quality coming out through things like this LEAP award, we'll be able to apply that to some of the sites Ken mentioned, some of the smaller sites that might not have the resources to do this work on their own. So it's both kind of getting the interfaces into multiple sites without requiring a dedicated data team, and then being able to kind of lift all the boats together as we improve the quality through the Cumulus Q LEAP award.
And Dan, let me just follow up with you on that one bit here. The goal here is because hospitals and physician offices are collecting all this data, the idea is that they all could use a different taxonomy, or they could use kind of a different way to describe something. Does FHIR and does the API and does all the work you've been doing in trying to help standardize that or bring it to a way that is easily creates structured data?
Yeah, that's exactly it. And it's really been a huge amount of work by the entire industry with a lot of leadership from the ONC to really take these concepts, which are, as you said, done in different taxonomies in different ways at healthcare sites, and create a common format for them that kind of goes down to the level of terminology systems to say we're all going to refer to this using the same nomenclature for this particular clinical term. And so the ONC has done that through the US Core Dataset for Interoperability, which is a standard that they've been maintaining and advancing with community input. And then the community has also kind of, as a collaboration of electronic health record system vendors, worked together to figure out how to represent those concepts in FHIR in a standard way through something called the US Core Implementation Guide. And so those pieces kind of put together with the standardized FHIR interfaces that Ken mentioned, kind of enable this data to be output in a way that's actually really useful for use cases like research, data exchange, clinical quality assessment, things like that.
Thanks, Dan. I appreciate that explanation. I think that helps us understand why this is so important. And on that note, we're going to take a quick break. We come back, we'll continue to talk about some of the challenges and opportunities ahead. I'm Jason Miller, and you're listening to the discussion, Government Modernization Unleashed, the Power of Data, sponsored by EY on Federal News Network. Welcome back. You're listening to the discussion, Government Modernization Unleashed, the Power of Data, sponsored by EY on Federal News Network. I'm your host, Jason Miller. My guests today are Steve Posnack, the Deputy National Coordinator for Health IT in the Office of the National Coordinator for Health IT in the Department of Health and Human Services, Dr. Ken Mandel, the Director of Computational Health Informatics Program at Boston Children's Hospital and a professor at Harvard University, and Dan Gottlieb, a technical architect in the Computational Health Informatics Program, also at Boston Children's Hospital. We talked a lot about the program that Boston Children's Hospital won through the LEAP in Health IT. Let me go back to Ken, talk a little bit about that project a little bit. How does it support the goals of using data to meet health equity and more broadly?
Well, to address the issue of health equity, we need to actually collect not only data from the full spectrum of healthcare sites, but for example, we need to understand the demographics of the patients that are being treated. That's an example of data that are required to be made accessible through the FHIR APIs that are under regulation, have to be supported in all certified health IT. But that doesn't mean that they're going to be there. The requirement that the data elements be supported is somewhat separate from the requirements that the data elements be collected, correctly mapped, and then made available in a standardized high quality format. So as step one, we need to understand the availability of those data elements across the healthcare ecosystem. There's no process to do that now, and we want to design a process that not only works for this award, but that can generate tools, tools that can be used widely to help with this effort. If we don't know that the data coming out are good or not good, then there's no feedback to the health systems on what they need to collect. If in addition to measuring the quality and the availability of these data, we actually put a demand signal and have federal programs that require that those data elements be reported for payment or participation in other programs, now we've got a sort of a nice ecosystem and a potentially virtuous cycle whereby the health systems are motivated to collect and make these data available. We can tell them if they're doing a good job, they can fix it where they're not, and we can have a widely available set of tools in the ecosystem and the right data that we need. And health equity is a great example of that, where it's very widely known that we don't have the data in the healthcare system today that we need to monitor these issues. Also, we need benchmarks for how to measure FHIR data quality and agreement. And we need hopefully this ecosystem of data quality measurement to be in the realm that we like to operate in, which is the open source, freely licensed tools, where the competition and the free market of American innovation happens on top of an interoperable ecosystem, and that the interoperable ecosystem itself is not necessarily the source, is not necessarily auctioned off on a free market. So this is really designed to support a free market of innovation on top. But our approach, and we think the requirements here, are that these toolkits be just accessible as a part of the national infrastructure. I'll turn that over to Dan to give us an idea now of how we're going to tackle that in this LEAP award.
Yeah, so talking about some of these challenges around assessing kind of what data is available in FHIR and how we might want to improve it iteratively over time, we kind of came up with four steps to working towards solutions in this problem. The first is, working with a broad group of stakeholders, including folks who are running health information networks, public health agencies, healthcare delivery organizations, healthcare IT developers, health insurers. So people from kind of throughout the industry, and kind of sitting down together and trying to come up with a standard set of metrics for how we would assess the quality of the data and the quality and availability of the data coming out of these FHIR interfaces. Again, the idea is really to develop a standard set of metrics that could then be applied at multiple sites and can be applied over time as systems get upgraded and change, so that we can be confident that as we pull data into research or use data for data exchange, that the data is going to accurately represent what's needed and include the information that's needed. So we want to come up with this standard set of metrics. And then one of the things that the Boston Children's team is going to do is try to materialize these metrics into, as Ken mentioned, open source software. So really make this freely available and as nicely packaged as possible. It's always a challenge to install new software, but we're gonna do our best there, so that folks at kind of multiple institutions throughout the healthcare system can easily apply these metrics to the data that's coming out of their clinical systems and potentially payment systems. And then we're going to test out the software. So we have a couple partner healthcare institutions, and we're going to try it and see how it works in real world sites, of course, iteratively improving the software as they run into issues, and then doing some root cause analysis as we find these data issues so that we can improve as many of them at the source. So if there are improvements in the systems, improvements in some of the terminologies that we're using, and we really want to apply those back to the core system so that they're kind of remediated everywhere those systems are installed. And then potentially, kind of depending on time in the grant, we'd also like to pull in other institutions into testing the software and be able to kind of have them participate in the iterative development process. So a lot of work, but it's, I think, pretty exciting, important area to move forward.
And Dan and Ken, this is being done over a 2-year period, because I think LEAP awards are kind of a 2-year prototype test. We're just a few months in, so I know there's plenty ahead of you. What's the timeline look like? Things I imagine are being done in parallel, meaning you're meeting with stakeholders, you're coming up with the metrics, but at the same time, you're thinking about how to test it and how to make it open source, or is it more of a linear approach to this effort?
Yeah, so I think it is that iterative approach. So we've already started meeting. We have actually 2 stakeholder panels. We have a stakeholder panel of kind of folks that are at the industry, and then we also have a technical expert panel that's helping us kind of decide on the right technology and technical implementations of some of these approaches. And we've already met with the technical expert panel. We have a stakeholder panel meeting coming up soon. So we've already started kind of pulling in that information. At the same time, our software developers have started doing some prototyping, and we're hoping to, we've been kind of talking with some of the partner institutions that are going to test out the software to get them up and running. So as you said, it's kind of a iterative process of doing a lot of things in parallel, and improving kind of the software based on the testing, improving the metrics based on what we learned from the software, improving software based on what we learned from our panels. So it's kind of happening in this kind of continuous cycle over the 2-year period.
Steve, let me pull you back into the discussion a little bit. What Boston Children's Hospital is going through, I'm sure, is a fairly typical approach that you're looking at through all these LEAP awards, LEAP and Health IT awards. Talk a little bit about what comes next as these awards have kind of come through the process over the few-year period. How do you and ONC use what comes from them, or how do you take what comes from them and apply it more broadly across the nation?
Yeah, absolutely. So, as I mentioned at the beginning, the LEAP and Health IT, program overall is to look at early stage investments that we can make to help accelerate, as the name suggests, different work in areas and look to scale. And so the work that Boston Children's Hospital is doing today is, something at the end of these 2 years, hopefully we'll look at the the iterative learnings, as Dan was conveying, in the software that they've been able to develop to just say, can we scale this nationwide? Is this something that's adoptable across the healthcare ecosystem? And we've seen that across through some of the different LEAP projects where the either reports, and each one is different. I would emphasize as well, everyone takes their own journey in terms of how they propose to address certain programmatic challenges that we've raised through the LEAP program. And some of them have final reports that then lead to policy changes and other types of considerations at a federal level. Some of them are back out to industry to say, hey, we were able to get so far, but we think there's more work that needs to be done in this particular technical area. And we help bring that into the standards development organizations to turn the crank again in terms of new technical advances that need to be made as well.
Steve, we got about a few minutes left, and before I let you go, I just wanted you to expand the discussion just a little bit. This idea of health equity data is not just through this one grant program. This is a really major focus for the Biden administration, for ONC, for HHS. Talk a little bit about how you're measuring the progress and the impact of ensuring that there is health equity and using data to do that.
Yeah, absolutely. So, health equity is an all hands on deck experience. It's something that is going to take time to go through, and this is across the board. So as we look at alternative payment models, different types of payment policy with value-based care, the different types of quality measurement that we want to do, different types of population health, public health related responses, it can really ranges across the spectrum of a lot of different policy interests, as you mentioned, for the administration. For us at ONC, that has more of a digital health focus. We've taken what we call a health equity by design, kind of principled approach, that as we start on new projects, as we start on initiatives, as we work on policy, we're always looking at it from a perspective of, what type of impact is this going to have on health equity? What can we do to help advance health equity related objectives and goals? And so, as we look at different ways to measure and assess health equity, one of the things that we included in that toolkit that I mentioned, there's certain areas around process measurement in terms of changes and individual level impacts. There's certain changes around utilization measurement that we can do, quality, as I mentioned before, and then financial impact as well. And so, there's a variety of different impacts that people experience on a day-to-day basis. And, as Ken mentioned earlier, the system the healthcare system as a whole has tremendous variation in terms of the type of data they collect, with the ways in which they use it, and the ways in which they apply it to improve care. And so as we look at, the next few years, this project that we have through LEAP, among many other initiatives that we work in collaboration with both our state and federal partners, will help advance a lot of these different measurement areas.
Gentlemen, I've very much enjoyed our conversation. Unfortunately, we are out of time for today. I think we could talk of much longer, because this is just a topic rich with important information. Let me thank my guest. Steve Posnick is the Deputy National Coordinator for Health IT in the Office of the National Coordinator for Health IT in the Department of Health and Human Services. Dr. Ken Mandel is the Director of Computational Health Informatics Program at Boston Children's Hospital and a professor at Harvard University. And Dan Gottlieb is a technical architect in the Computational Health Informatics Program, also at Boston Children's Hospital. Gentlemen, thank you so much for taking the time to join me today.
It's been a pleasure, Jason.
Thank you.
Thanks.
I'm Jason Miller, and you've been listening to the discussion Government Modernization Unleashed, the Power of Data, sponsored by EY on Federal News Network. For more on this discussion, visit federalnewsnetwork.com and search EY.